One of the questions we sometimes get is, I broke the spool, not sure why. And typically the reason why people will break a spool is because they over-tighten the system. And they may over-tighten it for a couple different reasons. The first reason and the first thing to check would be the flexible insert. Make sure the flexible insert is actually flexible, okay? It needs to move. If it's too stiff or too thick, they're not gonna feel the compression, and they're gonna tighten up the dial, and if they're strong enough, they can overpower the dial and actually shear the spool right in half. The other thing you're gonna wanna check is the padding, okay? If they can't feel compression, make sure that they have the appropriate padding behind the panel. We usually use a medium density puff or a P-light. If the padding is too soft, when they compress the panel, it's gonna pack the padding really thin and they're not gonna feel the compression. And again, they could over-tighten the system. And the third thing you're gonna wanna check or actually educate the patient around would be for them to look at the system as they're tightening it. Once these panels become flush with the frame, there's no more compression can happen, okay? We can't invert the panel sub-frame, go below the frame, okay? So once all these panels are flush with the frame, they should stop tightening the dial, okay? If they look down and they see that it's flush and they continue to tighten the dial, they're most likely gonna shear the spool in half and you're gonna have to get a new dial replacement.